Our next speaker is Walt Guterbock, and Walt received his DVM and his master's in parasitology from the University of Illinois in 1978 and 1979, respectively. He then worked exclusively in dairy practice, client education, and at dairy consulting in Southern California from 1979 to 89, specializing in milk quality and young stock management. And then from 89 to 94, he was a production medicine clinician at the Veterinary Medical Teaching and Research Center at Tulare, and then he worked in clinical practice, clinical teaching, and then performed research on mastitis treatment and on digital dermatitis. And then in 94, he began working in dairy farm management for several dairies in Hanford, California. And then from 98 to 2004, he was a managing partner of a 700-cow dairy in Scotts, Michigan. He then managed a 3,000-cow dairy in Michigan. And in 2007, took a position managing the Columbia River Dairy in Boardman, Oregon, which currently milks 25,000 cows. He retired from that position in 2012, but remains a partner in the young stock raising business associated with that dairy. He has extensive consulting experiences in various countries and has spoken at numerous professional meetings and seminars. Dr. Guterbock.
Thank you. I feel like the beneficiary of an affirmative action program being a dairy guy at a beef meeting. You know, with the collapse in the beef cow herd, more and more dairy calves and dairy cross calves are ending up in feedlots. So there's probably, my talk will not deal with performance of dairy calves in feedlots. That's, I had enough to write about with just dairy performance, but that is a thing to consider. So one thing that hasn't been mentioned yet, which I learned in doing I kind of knew, but I learned in doing my literature search, is that cattle among domestic animals are uniquely susceptible to respiratory disease. They have a smaller gaseous exchange capacity in relation to their body weight than other farm animals. They have less effective clearance mechanisms, generally lower oxygen levels in the lung, especially at high altitudes, or with high metabolic activity, which can slow clearance and the immune response. And the bovine lung does not have many of the interconnections that other species have, so that parts of the bovine lung are susceptible to being occluded, which of course gives the pathogens an easier time. So this slide is from Sam Behringer, whom many of you probably know, and he's certainly a very opinionated person, but he says that a cow has 30% lung capacity of a similar-sized horse and 250% the oxygen consumption. Remember that a lactating dairy cow is a metabolic athlete eating at 4 times maintenance, and there's very few animals, maybe a laying hen or a lactating sow, that do that. So they're metabolic athletes. There's a big demand for oxygen. And Sam states that the rate-limiting organ in the first year is the lung. And I was interested to hear what Mike was saying, that, you know, maybe, well, I'll get into this later. Maybe rapid growth is a risk factor for respiratory disease, but that's a question of mine. That's not an assertion. So what are my biases? Similar to what Dr. Miles, who was quoted earlier, says, disease occurs when the bugs overwhelm the defenses. In practice, I always concentrated on management factors and feeding, trying to have a healthy animal that would resist pathogens rather than focusing on chasing organisms. So I didn't have a lot of interest in vaccination programs. We just used a standard program, and that was good enough. I'm not saying that's right or wrong, but that was my philosophy. Management and feeding affect the immune response clearly, and it's generally more fruitful, and this is especially true with dairy calf programs, to address the management and feeding issues than chase bugs. So you can send calves to the diagnostic lab forever and not come up with the true answer, which is that they're starving, and that's why they're dying, because the diagnostic lab will send you an endless list of pathogens, and it could be this and it could be that. And in calf programs especially, I've found that there's a very quick and gratifying response to basic management improvements if people will just follow the 10 basic rules of raising calves. So the first problem in defining the impact of respiratory disease in the dairy industry is what is respiratory disease? So some respiratory diseases don't seem to be included in the definition, such as calf diphtheria, interstitial pneumonia, lungworm, emphysema. So generally, BRD seems to me, at least from the literature I've read, to be disease caused by the usual pathogens, Mannheimia, Pasteurella, and Mycoplasma, and the viruses. Secondly, and this really applies mostly to adult dairy cows, bovine lung sounds are very hard to interpret. Half the lung is obscured by the scapula, and at least this goes back a long way, but in vet school I was taught that there's not much correlation between what you hear and the lesions. I think there's other speakers who will address this, who know this better than I and may disagree. But often on the farm when we're trying to listen to a lung, we're in a noisy environment. The feed truck goes by, you're in the milking parlor or whatever, the chute is rattling. And any cow with a fever will be breathing fast and will have lung sounds that we could call harsh. The definitions of lung sounds are vague, to say the least. And most sick cows, again talking about adult cows, will stop licking their nose, and so they'll have a nasal discharge. So it's easy to say that almost any cow where you can't figure out what's going on, she has a fever, she's breathing fast, she's got snot in her nose, has pneumonia. Does that mean she really has pneumonia? Maybe not. In calves, I've been guilty of teaching vet students and dairymen for years that there's only two calf diseases, diarrhea and pneumonia. So almost any sick calf that's not scouring, on most places, will be recorded as a pneumonia, especially if they're over a month of age. And again, a calf with fever will breathe fast and with more effort. And in large operations, the treatment crew has to work fast. They have no economic interest in reducing the amount of drug used. They are more afraid of having calves die than of using too much medicine. And so the incentive is to treat early. And in most studies, and in my experience, if a veterinarian does this, they'll treat a lot fewer animals than the treatment crew will. And salmonella can be a big confounder. We think of salmonella as a diarrhea disease, but in its early manifestations, it's just a calf with a fever that's lying in the hutch breathing fast. And we have experienced this on the calf ranch where I'm active, or where I'm still a partner, that we'll have a salmonella problem and all of a sudden our respiratory disease prevalence will shoot up, and it's really been a salmonella issue, which we figure out a little later. So first I'm going to talk about adult dairy cows. NOMS surveys in dairy are based largely on producer interviews. We'll hear a lot more about NOMS from NOMS people later. But surveys said that between 2.4 and 2.9% of cows are diagnosed with respiratory disease, and it's responsible for about 11% of dairy cow deaths. In my practice experience, I didn't diagnose much pneumonia. Again, it's kind of a default diagnosis for a febrile cow that's breathing fast. In modern dry lot dairies and well-designed freestall dairies, it's just not very common. And most of the practitioners that I've talked to would agree. There may be people in the audience who disagree. In traditional tie stall or stanchion barns where ventilation may be poor, this may be not be so true. And so we have to estimate the impact of respiratory disease in dairy cows by indirect evidence. There aren't any there is no data that I could find that's based on actual counting cases in a large number of dairies. So I'm going to construct some back-of-the-envelope calculations and take them with a big grain of salt, but I think the numbers turn out to be kind of reasonable. So McConnell took on the heroic task of necropsying every dead cow on a big dairy in Colorado and found, interestingly, that producer-given reasons are only 55% accurate when compared to necropsy results. I think that's important when we're evaluating the results of surveys. 6.4% of cows died, which, as an industry-wide number, I think is in the ballpark. It's too high, but it's somewhere between 5 and 10% of dairy cows die on the farm. And about a third were culled, which is also a reasonable number in the industry. And 7% of the deaths were due to respiratory disease. And then I was trying to find data to see how much serious BRD is found in dairy cows at slaughter. And the only thing I could find was this study by Razak, where I think it's for 3 days, I believe, he looked at all the carcasses of culled dairy cows that went through one Midwest plant. And 10.3% of the slaughter cows had severe bovine respiratory disease. That doesn't mean they were condemned, it just means they had it. So a 10-year average of culled dairy cows in the U.S. is about 2.7 million a year. So we could estimate about 270,000 culls have severe respiratory disease. And figuring back from McConnell, roughly 35,000 cows would die on the farm from BRD. Adult dairy cows we're talking about, not heifers. These are adult cows. So roughly, if you add the two, 300,000 cows were culled or died, plus those that recovered. So the NOMS estimate was around 250,000. I'd venture to guess that that may be a little low because you can get to 300,000 just with the culls and the deaths, and some of them did get better. But the important thing is that for every of these 300, for every 300,000, if these 300,000 in fact were culled or died, every $100 of lost cow value would be $30 million lost to the industry. And I'd venture to say that the actual loss in cow value is probably 6 to 8 times that. So it is a significant cost to the dairy industry. The NOMS estimate, again, would be somewhere around 250,000 affected. The causes of adult cow respiratory disease are our old friends. Truparella is the new name I just learned for Corynebacterium. They may be secondary to viruses. I find it hard to make a case that the viruses are a significant part of adult cow respiratory disease. Adult cow, dairy cows generally are over-vaccinated for the viruses year after year. Sheila McGurk published a summary in a proceedings paper in Wisconsin on adult cow respiratory disease outbreaks in Wisconsin that she'd investigated, and said that they're usually associated either with new cattle introduction, lapses in vaccination, overcrowding, or undefined stressors. So let's talk about calves. And we're not talking about a terminal calf like this, which really needs a dose of intracranial lead. But it's amazing when you post some of these how little functional lung capacity they still have. A third, maybe a third or a quarter of their lung is still functioning. And there's no hope for a calf like this. But it's a much more subtle thing before it gets to this point. So again, respiratory disease is often a default diagnosis for any sick calf that doesn't have diarrhea or any sick calf over a month of age that doesn't have an obvious other problem like bloat. Salmonella is a confounder. The organisms are the usual suspects that I listed for the adult cows. From the literature, there's probably people here who strongly disagree with this, but the literature doesn't really support a strong role for the viruses. There's some evidence that BRSV may be important in some areas, in some cases. I think we'll see some data later. In Ireland, one study showed that PI3 they thought was the most important virus. But it's pretty hard, based on the literature I reviewed, to make a strong case that the viruses are a big problem. Now, they may be one of the stressors, I don't know, but I don't think vaccination is the answer, is what I'm getting to. Colostrum delivery is not as important in the prevention of BRD as you might think. I always thought it was extremely important. There's some conflicting evidence in the literature. If you think about it, if the disease mostly occurs in the second month of life, maybe a lot of the benefit of colostral immunity is gone. I still think colostrum is very important, one of the most important things we can do for these dairy calves, but it may not be as crucial in the prevention of BRD as other things. And of course, there's the big question of ventilation, and in a study done by Lago in Wisconsin, it appears that although we all love to talk about ammonia, the literature on ammonia in dairy calves isn't that convincing, and it appears that the concentration of bacteria in the air is the most important factor. There's certainly huge benefits to be obtained from improving ventilation for calves that are housed indoors. There's no question. And Dr. Nordland and others at Wisconsin have done some great work on this. So what about the prevalence in dairy calves? The NOMS interviews estimated around 12% of calves were affected, pre-weaned dairy calves now, under 60 days, and 11% were treated. In 2011, NOMS surveyed heifer raisers. This was just a survey, an interview, 16.4% of pre-weaned and 11% of weaned calves, which gets you to about 27% total. There's no good nationwide data based on systematic case records, and I'll show you that data in a minute. But all the studies can agree that there's a very low prevalence in pregnant heifers. So this is a phenomenon of the first year of life and mostly the first 6 months of life. So in the prevalence studies, they were generally done by, obviously, university people who studied some sample of dairies near their university, either in Ontario, well, anyway, in Canada and the U.S. One study was in Sweden. Some studies measured prevalence, but some of the studies were measuring something else and just reported prevalence. They almost all relied on owner-manager reporting of cases and generally treatment records. There was some verification by vets in some of the studies, but certainly not in all. It's never, I shouldn't say never, few of them make it clear how they handled repeat cases, how do they define what a repeat case was as opposed to a new one. The Dairy Calf and Heifer Association's gold standard would be less than 10% treated for pneumonia before 60 days before weaning, and less than 15% after, so that gets you to 25% by 120 days, which is sort of the ballpark of where we're headed. So these are all summarized in the preceding papers in excruciating detail. There's a wide range in prevalence. There's also a lack of consistency in these studies in age as reported. So here, for example, you have 23% total pre-weaning post. Here you have 27. This guy was just pre-weaning. So was this one. These guys were looking up to 6 months. And in Saskatoon, this was to 90 days. And so forth. So if you sort of look over this list, the range is from about, this study here, they distinguished between dull calves and BRD calves, and I submit that most people would have called the dull calves BRD calves, so I combined them. So what's interesting is that the median age of onset where that was measured was quite early, 25 to 27 days, which also reflects our experience. And if you do a mental average on this, you come out, somewhere in the 25 to 35% range of affected dairy calves to around 6 months of age. So one thing that's happened in the dairy industry in recent years has been that there's been a big emphasis on improving the feeding of pre-weaned calves. And these are old slides from a calf ranch in California where they were feeding the old, starve them into submission so they'll eat grain. Feeding program, 2 quarts of 20/20 milk replacer, twice a day, rain or shine, summer and winter. And this is a calf right after birth, and you can appreciate that it has some meat on its bones. And this is a calf on the same ranch 3 weeks later, which is a time I love to look at calves. Obviously, there's a big loss in body condition. So we've had a huge emphasis in the dairy industry in recent years as we've woken up to this tragedy of what's called accelerated growth, or some people would say it's normal growth. Anyway, feeding a dairy calf more like a beef calf where it gets to drink a lot of milk and drink it more often. And the result has been that and this is also true of the ranch where I work, where we're dealing with Jerseys, which are much harder to raise than Holsteins. We've really improve the nutrition of the young calf by increasing the energy and protein that we feed them at huge cost. We wean a beautiful calf. They don't lose body condition to 3 weeks. We've basically eliminated scours as a significant disease entity. But we have not improved respiratory disease rates. And so this is a slide from Mark Kirkpatrick from Zoetis. It's a survival curve. We start with 0 prevalence of BRD, and as each case accumulates, the line steps down. And the lines are quartiles of birth. And you can see that in some quartiles, now we may have had a salmonella problem in here. In fact, we did. 90% of the calves by 150 days have been treated for BRD. And our running average now is about 50%, 40 to 50%. And that's not uncommon on calf ranches or in heifer raising facilities. So, and we're doing a good job with the pre-weaned calf. You'll have to take that on faith, but it's true. So what are the effects? So anyway, the point of this slide is that BRD in pre-weaned dairy calves is not a problem that's getting better. And there's anecdotal evidence from other people in situations where they're ad lib feeding calves and group feeding calves where calves get to drink a lot of milk that BRD is, or respiratory disease in those calves is certainly not better either. And that's confounded by the fact that in many group feeding programs, the calves are housed indoors, which adds the ventilation dimension to it. So what are the effects of BRD on the performance of dairy calves? It certainly doesn't help them. It increases the death rate. It lowers the rate of gain. I'm sure it has some impact on their performance in the feedlot when they get there. I don't have any data on that. I've always asked the question, we always assume that it's pneumonia that reduces growth. In the dairy industry, with calves, now we're proceeding on the assumption that it's slow growth that causes pneumonia, so we're feeding for higher growth, but we're not being rewarded with lower prevalence of BRD. But certainly respiratory disease is the main reason that young heifers get culled prematurely. The problem with analyzing performance of heifers on lactation is that the first lactation performance of a dairy heifer depends on a lot of stuff besides what happens to her in her first 6 months of life. So it depends on her age at first calving, which in turn depends not just on feeding, but on the efficiency of the reproductive program, and specifically when did they start breeding these heifers. We think it depends now on the growth rate in early life. There's substantial evidence for that, although not everybody agrees. It depends on the size and weight at first calving, dystocia, season of calving, paraparturient diseases, and so on. So since BRD occurs early in life, it's pretty hard, even from the studies, to see what the effect of BRD is on lactation performance. It does seem to have a small effect on age at first calving on the order of 2 weeks, and that's pretty consistent across 3 or 4 studies. There's conflicting evidence on lower survival. Some studies say yes, some say no. It seems intuitive that it would reduce survival to first calving, but the studies don't necessarily show that. There's slight differences in milk yield and protein yield and fat yield. Some of the studies combined respiratory disease and diarrhea, which kind of complicates the analysis. So it's tough to make a case from the literature that this has a huge effect on first lactation performance, but it certainly doesn't help. So the riddle for me, as a practitioner and as a producer, is why is it that these calves that are raised outside in hutches, there's no indoor housing, there's presumably no ventilation problem. Now we could argue that maybe the air in this hutch gets foul, certainly gets plenty hot in there in the summer, but these calves were on gravel, not a lot of bedding here in the summer, no bedding in fact. They're healthy, they're fat. We have a calf raiser, Cheryl, who worked for me, who loved every calf. Why would they get pneumonia? Or this calf, a healthy, fat calf, maybe a little too fat, in a hutch. Why should she get pneumonia in the hutch? It's a very different situation here where you have calves housed indoors, a robot feeder, human-designed ventilation. It's much easier to make a case here that we could maybe spread respiratory disease. But in this outdoor situation, this is the ranch in Oregon, again, now, is it hot here in the summer? Yes. Is it windy? Yes. Is it dusty? Yes. But you can't, the bedding has changed, the hutches are clean, the calves are well fed. It's really tough to see why we have this high prevalence rate of perceived respiratory disease in pre-weaned calves. And then after weaning, they come out, first in our place, they first go to super hutches, then they come out to these pens. And before we used to wean directly into these pens, they weren't crowded. Although we did see loose manure in these, we couldn't make a case for coccidiosis. We looked and we looked and we looked. We never found it. These calves are on cradle-to-grave rumensin. So it's, the ventilation is good. Of course, there are behavioral issues here. They have to learn where the feed is. They have to learn where the water is. They have to adapt to group life. Those are all stresses, surely. But again, you look at a facility like this and say, why, we're training the calves to where the feed is. We try to ease the transition as best we can, yet we still have too much pneumonia. Why is that? So that's the question. And an additional question that I have is whether given the limitations of the bovine lung, does rapid growth predispose to respiratory disease? That is a question, not an assertion. Of course, we have to ask what the role of genetic resistance is and how we can stimulate a better immune response, because most of the pathogens are commensals in the bovine respiratory tract. Most of them are present at birth or in the urogenital tract of the mom. Most of the pathogens are present at birth. They live in the pharynx. What breaks down is the resistance of the calf, and it's interesting to think about why. Thank you.